Hey everyone, welcome back to Ask Dr. Slater. In this series, you get to ask me, a board-certified orthopedic specialist with 17 years experience in this field, your healthcare questions. So if you found this helpful, make sure to like and subscribe so you can submit your own questions that we'll be answering each week. Let's get to it. If you have Crohn's disease, listen to what this person wrote. As someone who has had Crohn's disease for over 30 years, I can confidently say that you are talking absolute garbage and you should be ashamed for flogging this nonsense. I'll stick to the advice of the excellent IBD team I'm under, thanks, and you are wrong. There are very specific tests to diagnose Crohn's. There are not specific tests to diagnose Crohn's. There's no test that will definitively diagnose Crohn's. They will find symptoms, and they will say these symptoms most fit this condition, Crohn's, ulcerative colitis, a different IBD diagnosis. And then also too, I understand that this is different information, and I'm not saying by any means that everybody out there that has Crohn's or ulcerative colitis or an GI issue has a spine issue, but there are definitely people out there that are getting diagnosed with these conditions, and then they're getting treatments like the steroids, like the biologics, and they don't actually have this problem. And if you want to know more, go to my website, go to my podcast. I interview patients that I've treated for these conditions by treating their spine because it wasn't an underlying issue of Crohn's or ulcerative colitis. It was a spine issue causing all of their symptoms, and they were misdiagnosed. So I get it. I get why I sound like a clown. And I was afraid or nervous to share this information at the beginning, but now it's helped so many people. I'm gonna keep saying it even if you're out here insulting me. Cheers. All right, so we're talking about spinal shifts, and one of the most common shifts is at the lumbar spine, where you see people standing like this. There's different ways to treat it, but there's a shift at the neck, and this would be deemed torticollis or dystonia. And the best way to treat that is actually to move the neck in the side, towards the side of the problem. So typically if you're shifted away, you want to start moving the neck in that direction. I'll try to do a more thorough post about how to actually go about this, but if you're a physical therapist out there and you're wondering how to treat these shifts, I normally get the patient lying on their back, unloaded. I initially start moving their neck into a side flexion position, and then I have them start helping me with muscle motor control in order to get there as well. This is the range of motion movement that I typically start with. If you want to go to a local provider, McKenzie Physical Therapists will do a decent job at this. You can go to the McKenzie Institute, USA.org, and find a local provider. Stop stretching your piriformis. So this person writes, I need stretches for the piriformis muscle, please. Stop stretching. And now I've tried treating the piriformis in so many different ways throughout my career. Obviously a lot of different types of stretching and loading, different types of muscle contraction and nerve gliding and stuff like that in order to treat the piriformis or piriformis related issues. If it's a tight muscle, okay, if the piriformis is tight, then stretching will work very, very well and very, very quickly. Within 1 to 2 stretches, you're 50 to 60% better. Within 2 to 3 days of stretching that area, you are significantly better. If you're not getting that relief after doing a few days of stretching, then it wasn't a tight piriformis muscle. Okay, and also think that that tightness, let's say it is from the piriformis itself, which it often is, it's actually higher up from your lumbar spine where the sciatic nerve actually starts. But if it was a tight issue, most of the time actually contracting the muscle is what will lead to the muscle being more flexible, more pliable, and now after you've contracted it, now it'll actually respond to stretching better. So for the most part, I don't passively stretch the piriformis for problems in this area. The first thing I do is look up to the spine. If it isn't a spine issue and it's actually at that piriformis region, I contract it before I stretch it. That's it for this week of Ask Dr. Slater. Make sure to leave your questions in the comments. Make sure to hit like and subscribe so you don't miss this series. Stay tuned next week.